Welcome to our in-depth exploration of cardiac function. Here's the index at Sum Ch. In this first video of the series about cardiac function, we'll cover the first part of the 17th chapter of the Pathophysiology book by Jacquelyn Banasik and Lee Ellen Copstead. Here's the index of topics: heart location and structure, layers of the heart, chambers and valves, pericardium, circulatory system, cardiac cycle, coronary circulation, regulation of coronary blood flow. Let's dive right in. Cardiovascular anatomy. The heart is centrally located in the thoracic cavity within the mediastinum, which is the central compartment of the thoracic cavity. It is suspended between the lungs, posterior to the sternum, and anterior to the vertebral column, thoracic aorta, and esophagus. When viewed from the front, the heart appears rotated to the left. The right atrium and right ventricle are the most anterior parts of the heart, while the left atrium and left ventricle are more posterior. The base of the heart leans toward the right side of the chest and is relatively fixed by its attachments to the great vessels. The apex, which points downward, forward, and to the left, is located in the fifth intercostal space at the mid-clavicular line. The position and size of the heart can vary depending on several factors, such as age, body size, shape, weight, and pathologic conditions. These variations can affect the precise location of the heart and the point of maximal impulse, or PMI, which is the area where the heart's beat is most strongly felt. The PMI can be palpated where the apex strikes against the chest. Layers of the heart. The heart wall is composed of three layers. One type, endocardium. This is the inner layer, consisting of squamous epithelial cells that provide a smooth lining for the heart chambers and valves, minimizing friction and preventing clot formation. The endocardium is continuous with the endothelium of the blood vessels. 2. Myocardium. The thick middle layer composed of cardiac muscle responsible for the contractile force necessary to pump blood. The myocardium's thickness varies between the chambers, being thickest in the left ventricle to generate the high pressures needed for systemic circulation. 3. Epicardium, also known as the visceral pericardium. This is the outer layer of the heart. It forms part of the pericardial sac, which encloses the heart and is comprised of two layers: the visceral pericardium, attached to the heart, and the parietal pericardium, forming the outer layer of the sac. Chambers and valves. The heart has four chambers, atria, right and left. The atria are the receiving chambers with relatively thin walls, since they only need to pump blood into the ventricles. Ventricles, right and left. The ventricles have thicker muscular walls, especially the left ventricle, which pumps blood throughout the systemic circulation. The right ventricle pumps blood into the pulmonary circulation. To summarize, right atrium receives deoxygenated blood from the body via the superior and inferior vena cava. Right ventricle pumps deoxygenated blood into the pulmonary artery and lungs for oxygenation. Left atrium receives oxygenated blood from the lungs via the pulmonary veins. Left ventricle pumps oxygenated blood into the aorta and throughout the body. The walls of the ventricles are thicker than those of the atria, reflecting the higher pressures required to pump blood out of the heart. The left ventricle, which pumps blood into the systemic circulation, has the thickest walls due to the high pressure it must generate. In the table 17.1 of the chapter are stated the normal chamber pressures. So we have table 70.1, normal pressures in the heart. Right atrium, 0 to 8 millimeter of mercury. Right ventricle, 15 to 28.8 millimeter of mercury. Pulmonary artery, 15 to 28.44 to 12 millimeter of mercury. Left atrium, 4 to 12 millimeter of mercury. Left ventricle, 100 to 124 to 12 millimeter of mercury. Aorta, 120, 60 to 80 millimeter of mercury. Valves. There are four main valves within the heart that ensure unidirectional blood flow through the chambers. Atrioventricular valves, the tricuspid valve, right side, and the mitral valve, left side, prevent backflow into the atria during ventricular contraction. Mitral valve, bicuspid valve, located between the left atrium and left ventricle. This valve allows blood to flow from the left atrium into the left ventricle and prevents backflow during ventricular contraction. Tricuspid valve, positioned between the right atrium and right ventricle, it facilitates blood flow from the right atrium to the right ventricle and prevents backflow during ventricular contraction. Semilunar valves. The pulmonary valve and aortic valve prevent backflow from the arteries into the ventricles during relaxation. Pulmonic valve, pulmonary valve. Found at the junction of the right ventricle and pulmonary artery, it opens to allow blood to flow from the right ventricle into the pulmonary artery and closes to prevent backflow into the right ventricle. Aortic valve, located between the left ventricle and the aorta, it permits blood to flow from the left ventricle into the aorta and prevents backflow into the left ventricle during relaxation. Supporting structures. Cordae tendineae, tendinous cords that anchor the AV valves to the papillary muscles in the ventricles. These prevent valve prolapse during ventricular contraction. Papillary muscles, muscles located in the ventricles that contract to tighten the cordae tendineae, thus ensuring the AV valves close properly during ventricular contraction. Pericardium. The heart is enclosed within the pericardium, which consists of two main layers. Visceral pericardium, epicardium, the inner layer that directly covers the heart surface. Parietal pericardium, the outer layer, forming a sac around the heart. Pericardial space, the space between the visceral and parietal pericardium, is filled with a small amount of pericardial fluid that reduces friction during heartbeats. Circulatory system, systemic and pulmonary circulations. The heart functions as a dual pump in two interdependent circulatory systems. Systemic circulation, the left side of the heart pumps oxygenated blood from the lungs through the aorta to the rest of the body. Pulmonary circulation. The right side of the heart pumps deoxygenated blood from the body to the lungs for oxygenation. Venous return. Deoxygenated blood is collected from the body and returned to the right atrium via the superior and inferior vena cava. Cardiac cycle. The cardiac cycle includes several phases. 1. Isovolumic contraction. This phase begins with the closure of the AV valves, mitral and tricuspid, as the ventricles start to contract, increasing pressure without changing volume. Ventricular contraction causes an increase in intraventricular pressure. This pressure buildup leads to the closure of the AV valves, producing the first heart sound, S1. This phase lasts until the pressure in the ventricles exceeds the pressure in the aorta and pulmonary artery, leading to the opening of the semilunar valves, aortic and pulmonic. 2. Ventricular ejection. During this phase, the semilunar valves open, allowing blood to be ejected from the ventricles into the aorta and pulmonary artery. The pressure in the ventricles surpasses the pressure in the arteries, forcing the semilunar valves open. Blood is then rapidly ejected from the ventricles, causing a decrease in ventricular volume. This phase continues until the ventricular pressure falls below the arterial pressure, leading to the closure of the semilunar valves. 3. Isovolumic relaxation. This phase occurs after the closure of the semilunar valves when the ventricles begin to relax but before the AV valves open. Ventricular relaxation leads to a rapid drop in intraventricular pressure. The semilunar valves close to prevent backflow, producing the second heart sound, S2. During this phase, there is no change in ventricular volume. This phase ends when the pressure in the ventricles falls below the pressure in the atria, causing the AV valves to open. 4. Ventricular filling. During this phase, the AV valves open and the ventricles fill with blood from the atria. With the AV valves open, blood flows passively from the atria into the ventricles due to the pressure gradient. This phase includes rapid filling, reduced filling, and atrial contraction, atrial systole. The majority of ventricular filling occurs passively during the rapid and reduced filling phases, with the final portion contributed by atrial contraction. 5. Atrial contraction, atrial systole. This phase involves the active contraction of the atria, pushing the remaining blood into the ventricles. Atrial contraction increases atrial pressure, causing additional blood to flow into the ventricles, ensuring they are fully filled before the next ventricular contraction. Atrial systole completes the ventricular filling process, contributing about 20 to 30% of the total ventricular volume in a healthy heart. The cardiac cycle then repeats with another isovolumic contraction phase. Coronary circulation. Anatomy of coronary vessels. The Coronary vessels supply oxygenated blood to the heart muscle. The major coronary arteries are the right coronary artery, RCA, and the left coronary artery, LCA, which further divides into the left anterior descending, L8 artery, and the circumflex, CX artery. One right coronary artery, RCA, supplies right atrium, right ventricle, and a portion of the left ventricle. Branches includes the right marginal artery and the posterior descending artery, PDA. 2. Left coronary artery, LCA, divides into left anterior descending, L8 artery, supplies anterior portion of the left ventricle, the interventricular septum, and the apex of the heart. Circumflex, CX artery, supplies lateral and posterior walls of the left ventricle and the left atrium. Table 17.2. Areas supplied by the coronary arteries. Right coronary artery, RCA, right atrium, right ventricle, bottom portion of both ventricles, and back of the septum. Left anterior descending, LA artery, front and bottom of the left ventricle and the front of the septum. Circumflex, CX artery, left atrium, and the side and back of the left ventricle. Most of the heart's capillary beds drain into the coronary veins, which then empty into the right atrium through the coronary sinus. Coronary veins, such as the small cardiac vein and others, drain blood from the myocardial capillary bed and deliver it into the right atrium through the coronary sinus. Regulation of coronary blood flow. Coronary blood flow is finely regulated to match the metabolic needs of the myocardium, primarily determined by oxygen demand. 1. Metabolic regulation. Increased myocardial activity raises oxygen consumption, leading to the production of metabolites like adenosine, which vasodilate coronary vessels. 2. Autonomic nervous system. Sympathetic stimulation increases heart rate and contractility, leading to increased coronary blood flow. Parasympathetic influence, primarily through the vagus nerve, decreases heart rate and indirectly reduces coronary blood flow. 3. Endothelial function. The endothelium produces vasoactive substances like nitric oxide, NO, and prostacyclin that promote vasodilation, as well as endothelin, which induces vasoconstriction. 4. Myogenic mechanism. Coronary vessels can respond to changes in intraluminal pressure. An increase in pressure can cause vasoconstriction, while a decrease induces vasodilation, maintaining consistent blood flow. Thank you for joining us in this detailed exploration of cardiac function. This video is part 1 of a series of videos covering the whole basis of cardiac function related to Chapter 17 of the book Pathophysiology by Jacquelyn, Banasik, and Copstead. Stay tuned for more informative content not only in cardiology but also in other branches of medicine. If you found this content useful, please like the video, share it with others, and subscribe to our channel. Don't forget to activate the notification bell to stay updated on all our latest content.